Hello, I'm Dr. David Murphy. I'm a physician. I'm based in Leamington, Ontario in Canada, and I'm also a psychotherapist. Now, many of my patients and many of my colleagues also ask me, what is psychotherapy? Well, I like to think of psychotherapy as psychiatry without the medication, so I'm offering talk therapy solutions for mental health care issues, whereas psychiatry tends to offer medication treatments, and also psychiatry focuses on illness. So I think the other big difference between psychotherapy and psychiatry is that psychotherapy focuses on wellness. I am here to help my patients achieve the wellness that they would like to have, and it's up to them to decide what is their version of wellness for them. So I'm not here to fix my patients, I'm not here to tell them what's wrong with them, I'm certainly not going to tell them what's right or wrong for them. My only role as a therapist is to help my patients understand what they want and need, and to give them some tools to achieve that. And so what is the model of therapy I use to provide those tools? Well, I like to believe that we all have a guide to life in our minds. It runs unconsciously on the edge of our awareness, and that guide to life tells us all our beliefs about ourselves, our beliefs about the world, how to behave, how not to behave, what we personally think is right and wrong, what we should be happy about, what we should be afraid of, what to be ashamed of, what to be angry about, what to be sad about, what to be happy about. And we start writing that manual pretty much as soon as we're born. We're taking information in from the outside world on many different levels, even before we have language. And we certainly have large parts of that manual written before we're age 2. And remember, a 2-year-old is taking in language at the level of the ability of a 4-year-old to express it. So we're taking in a large amount of quite complex information without being able to express it ourselves. And we need to remember then that we need to be very careful what we're saying around children when they're very young, because they are understanding it even though they don't appear to. And so we've also written large parts of that manual before we're age 5, and really by 5 we've started to pretty much decide how we fit in with the world, even though we might not be able to put in those terms. And of course most of us don't even remember much before we're age 5, and yet we've really decided a lot about ourselves by then. So we continue adding to that manual throughout our childhood years. We might write significant passages based on significant events, traumatic events or major events that have been disturbing or distressing to us. But in general we tend to add to it a lot of what seem insignificant events, but still make changes for us within our lives, within our world. And so we have that manual, we take it from our childhood into our adult years, where it may or may not work very well. And I do find that patients become involved in therapy when the manual's not working in some way. So either the manual's telling you to do something that's not helpful or even destructive, or there might be a void there. There might be nothing there to tell you what to do. So you might be feeling kind of helpless or overwhelmed. And so what I do through our sessions and through a conversation, is to offer you some tools for making some changes, to bring that manual into your conscious awareness, and then change it, edit it, remove the passages that are unhelpful, put in passages that do work, almost like a policies and procedures manual that you might have in your workplace, and fill the voids, just fill the gaps, put in what you feel will work for you. And of course, it's important to have the tools to update it on an ongoing basis. If you only update it now, wait 10 years and you'll find that the manual's not working very well again. We change as we age. The world around us changes. We need to be able to adapt to those changes and update our manual on an ongoing basis. And so the therapy is carried out through a conversation, some exercises that we do during the sessions, and certainly homework that is done in between the sessions, because the therapy is not the sessions themselves. The therapy is what you do in between the sessions, because if you don't change anything, then nothing changes. And of course, not everything that I offer you will be helpful to you. In general, I offer ideas that work for most people, but we're all individual, we're all different. Not everything will work for you. And you will only find out what does work for you by putting the ideas into practice. And of course, even if the idea doesn't work for you, you will find that you learn a lot from the things that don't work, and that might well also give you the clues to ideas that will work for you that you want to include in your manual. So that, in a nutshell, is basically what I offer, just helping my patients achieve wellness, to find wellness, sometimes just to get out of their own way and just make wellness happen. And so I look forward to talking with you in person. You can find me on my Facebook page, which is Dr. David Murphy, Physician Psychotherapist. I also have a webpage, www.drdavidmurphy.ca. That's Dr. David Murphy, all small letters, no dots, no spaces, drdavidmurphy.ca. I look forward to seeing you soon. Goodbye for now.